Now this slide indicates target heart rate for exercise during pregnancy. So what is very nice is that they indicate by age level, so it is adjusted by age, and so sort of a low, moderate, and high fitness levels. And also looking at women who are with a BMI less than 25 or with a BMI greater than 25. So you as an exercise professional can use these target heart rate ranges. Now I would also recommend checking with perceived exertion to go along with that. Strength and flexibility definitely still needed as far as resistance training is concerned with women. Same recommendations, 2 to 3 days a week, maybe 12 to 15 repetitions. Avoid isometric contractions and anything that's going to cause the Valsalva maneuver. Women should not do supine positions generally after the first trimester. Prenatal yoga is fabulous, and a lot of women really do like that. They can resume exercise postpartum, 4 to 6 weeks. A lot of the hormonal changes of pregnancy persist at least 4 to 6 weeks after delivery, and then you can see 8 to 10 following, C-section, because they're going to have, a major surgery. So that's going to be very different versus a woman who has an uncomplicated delivery. What causes exercise to be terminated during pregnancy? Most women do well, but there are some women that really have some problems. So this is what causes exercise to cease. You can look at some of the list here, and it looks pretty serious. Headaches, dizziness, lots of body swelling. Are they getting preterm labor? Are they not gaining enough? So oftentimes, if they are not gaining enough weight, then the doctors may have them cut back on their exercise. But these all look, pretty serious. So women do need to get these checked out if they are having these. Preeclampsia is a very serious condition. It's high blood pressure during pregnancy, usually after 20 weeks. It's common in first pregnancies. So it can happen in younger women more so than older women. It could really happen to anybody. And so it's a very serious complication. It prevents the baby from getting enough blood and oxygen. One of the ways they can screen for this is obviously taking blood pressure. They also will have women do 24-hour urine collections to screen for the amount of protein in the urine. So there are some risk factors. Obesity, diabetes, high blood pressure before pregnancy, polycystic ovarian syndrome. But, it can also happen in women without risk factors. So there can be some very serious complications to the mother as far as liver damage, kidney failure, and then eclampsia, which is seizures. Preeclampsia signs and symptoms. So this is where if the woman has a rapid gain of weight and fluid retention, changes in vision, headache, the doctor's going to want to see her right away. They oftentimes have to be put on bed rest, which is not always practical. They may be on medication. If the baby is very premature, they try to administer the surfactant medication to get the lungs to develop more. And then what also ends preeclampsia is sometimes the baby has to be delivered. They try to hang on as much as possible, but sometimes the baby must be delivered to save the mother's life. There is still a potential risk of high blood pressure after the woman gives birth, but it appears to be low. So HELLP syndrome is the very serious syndrome, a preeclampsia variation. So they get hemolysis of red blood cells, they get liver enzymes, and they get low platelets. So they can be, they can have bleeding, they can have a ruptured liver, and it can be fatal to both the mother and the baby. So the baby must be delivered. So, this is something that you don't always consider. Pregnancy, everybody wants a healthy baby, and I know a woman who had this, and her baby had to be born early, and their NICU bill was $500,000, the cost of care, so you don't always anticipate that. So there can be complications, and that is the only thing that can really happen is the baby must be delivered. So, but overall, exercise in pregnancy is safe for women. They usually are going to need some sort of physician clearance. They can follow ACSM guidelines, the ACOG guidelines, and the CSEP guidelines. Women still can develop complications. Even the healthiest, youngest, young women, fit women, they can still get complications where exercise is going to be off the table.